The honourable member for Vancouver Centre.
Thank you very much, Madam Chair. And I listened with a lot of interest to the last speaker's, my colleague's remarks. And he's a chiropractor, and he said he was concerned about the medical hazards, and I believe him. I believe that he truly is. And I'm a physician, and so I would like to say why I support this bill. I support this bill, and I do know better, that's why. I support this bill because I think that what is most important to look at is a 2015 UNICEF report that came out and showed that, in fact, Canadian youth have the highest level of cannabis smoking in the developed world. But they also, at the same time, had the lowest level of cigarette smoking in the developed world. And the honourable member is right. Cigarettes are legal. They're sold, there are regulations, there are restrictions, there is legislation that talks about how they're sold and that talks about the packaging. The point is, 80% of Canadian youth in that survey said that it was easy to get marijuana. Now, this is it. If we are concerned about youth, and if we're concerned that youth, 80% of them have access to an illegal drug, and that they have the highest rates of smoking that drug in the developed world, it tells us that what we had been doing wasn't working. It tells us that our young people, who I agree with the member, whose frontal lobes are very susceptible to cannabis, etc., that our young people we have no ability to stop them from getting access to it. And all of the things that the honourable member spoke about impaired driving, etc., it also means that they're going to be driving impaired, that everyone is going to have access to this drug without any ability to regulate it, to look at it, to be able to look backward at what the surveys are showing us and what are the issues that are affecting people. It is obvious to me that we have to do this because we have to get rid of organized crime. The people who are profiting off our youth are organized crime because they're selling it to them. And what we're suggesting is, and I think that it is very clear in the legislation, that we are going to make this drug legal, and then we're going to regulate it, and we are going to put all of the legislation behind penalties for selling to a minor that is there for tobacco. Now, I don't know of any drug that is equivalent to tobacco. Tobacco is the only drug that when you use it as directed will kill you. Because you will get heart disease, you will get high blood pressure, you will get emphysema, you will get chronic lung disease, you will get stroke. So the issue is that we have this drug that is currently legal, that our children, thanks to all of the policies and the programs and the legislation that we put behind tobacco, are now amongst the lowest uses of tobacco in the world. If we take that template and we look at that evidence and we suggest that currently when 80% of our youth can get cannabis, and currently when we know that we have the largest number of youth in the developed world smoking cannabis, we have to do something. So let us look at the experience with tobacco. Let us look at this. Let us continue to regulate it. Let's make sure that you cannot sell it to anyone under 18. Let us make sure that we are monitoring impaired driving and impaired use. And I mean, we know, for instance, that there are tools right now in which to monitor impaired driving. How many people we know at Christmas time we see the police on the road looking out for people who are drinking and driving? How much has MADD done to look at the issue of drinking and driving? I say to you, Madam Speaker, that what we're trying to do now is to try and get the same results so that we can have eventually our young people amongst the lowest users of cannabis in the world in the same way that they're amongst the lowest users of tobacco. Not to do this would be absolutely irresponsible of this government, given that evidence. And so I support this bill because I agree with our member that we have to keep monitoring. The only use of cannabis is not through smoking. We need to look at the impact of smoking cannabis or of using it in other forms. There are oil, there are leaves, there are brownies, there are all kinds of other ways of using cannabis. And how we look at the quantity the quality of the cannabis and the quantity, because we want to make sure that people are not getting what they're getting now, which is the best, I understand, in my province of British Columbia, the best bud in the world. It comes from BC. So we need to be able to look at that kind of qualitative analysis in terms of the amount of cannabis in a piece of cigarette or whatever a person is using. These are important things for us to regulate and monitor if we really care about the medical effects and if we really care about the use of this. And yet, I point out, Madam Speaker, that cannabis has positive benefits, which I cannot say for tobacco. Cannabis has positive benefits, and we know it's used for neurological pain. It is used in terminal illness to deal with the side effects of chemotherapy. We know that it is useful in many instances. There's proof that it has some medical usage. How we monitor that will come through regulations. How we look at what the impacts are will come through regulations. It also means that when we have a piece of legislation and we do our homework and we do our surveys and we check out how many people are in fact using, now that how many children are using, what are the reasons that they still use, how can we tighten that legislation? All of those things are things that we will do the way we did with tobacco. But at the moment, Madam Speaker, I have to tell you that I see this as a good bill. Prohibition did not work. I see this as protecting our youth. I see this as preventing the supplier right now, who is organized crime, from being able to supply in the black market, in the schools and everywhere. I see the idea of putting a ban on promotion to youth, so that you're not going to have the nice, gaudy little things that appeal to youth. You're going to have packaging that's not going to appeal to youth. That's part of the legislation when we talked about looking at packaging. And the devil is in the details. So I think it's important to look at the fact that we're talking about non-promotional packaging to youth. I think it's important to work with the provinces, because it is the provincial police and it is the city police who are going to be looking at impaired driving. We have tools now to look at impaired cannabis driving, and we're going to have the training ready and necessary for law enforcement officers. But what I like about this, which we never had when alcohol and tobacco are still legal, we never put the kind of money into that proactive public education, public awareness, public understanding that there are side effects to this particular drug, as there are to alcohol and tobacco, and that in fact appropriate usage, the amount of dosage, this is where we will be able to start building the research capacity, the indicators, etc., that will tell us what is the appropriate way to use this particular drug. But keeping it out of the hands of our children, Madam Speaker, is for me the priority. It is the biggest responsibility this government has. And looking at all of the evidence, and our friend talked about evidence-based decision-making, this is evidence-based decision-making. At least we will be keeping our children safe. At least we will be monitoring usage. At least we would be checking up on who is selling and why. And the penalties for people selling to minors is particularly high. What is it, a maximum of 3 years in jail, or is it $5 million or $3 million? So we're looking at the same kinds of penalties we have for tobacco. And yet I don't hear any one of my members across the way talking about tobacco. I don't hear them talking about the ills of tobacco and what maybe we shouldn't legalize tobacco. Maybe we should make tobacco illegal if they care that much for the health of Canadians. Maybe we should look at how we deal with alcohol, because at Christmas, when the police are standing on the streets with their breathalyzer, they're checking for what drug? Alcohol. So we know that these drugs have negative effects. We know that one or two of them have some positive effects. I understand that there is work being done that says that red wine taken in moderate amounts is good for you, etc., for your heart and your blood pressure. So I am saying to you, Mr. Speaker, that we have a responsibility to bring forward this legislation. And anyone who stands up in this House and said that they care about our youth and they care about the health of Canadians would support this, because it's a way to begin to control something that right now is not controlled at all. Thank you, Madam Chair.